Bruxism is a repetitive jaw muscle activity characterized by clenching or grinding of the teeth and/or by bracing or thrusting of the mandible. It has been also stated that Bruxism has two distinct cardian manifestos. It can occur during the wakefulness, indicating as awake Bruxism, and during the sleeping, indicating as sleep Bruxism. The first video should be concerning about the topic, and the next video will be about self-management of the Bruxism. In these kind of cases, multiple professions should work together to get the best result. For that reason, I asked Anni Luoto, dentist PhD, to join this video with me, and she said yes. I don't get often that kind of answers. Bruxism prevalence is, according to Vetla's article from 2019, around 5% during the wakefulness and during the night 16.5% in big population. In same article they told that biting teeth together is more present in females than males. Sojo et al. Had great article about Bruxism, and they briefed this three-way approach to this kind of situation. First comes the night bracers. They protect the teeth and prevent future damage. Number 2 is the behavioral point of view. We need to inform the client about the situation in hand, how to guide through the simple relaxation exercises, and try to make clear that the way of the life might have some sort of effect on the symptoms, and bad night's hygiene might also provocate symptoms during the night. As third, certain medication is needed if we don't get good results from the first two point of views.
Common symptoms of the teeth grinding vary from mild to severe. Headache, migraine, temporal headache are one of the common symptoms. Your jaw is sore and you don't feel like talking because of the pain and fatigue in your cheeks. Your jaw may lock and the temporal joint might click and your face aches and you may feel pain in front of your ear. Opening of the mouth is limited, especially after awakening, and the difficulty may continue throughout the day. For example, you can't fit 3 fingers in your mouth. Temporal joints are sore and your ears hurt and you may experience tinnitus. Your teeth are hypersensitive and the surface of the teeth are flattening and the fillings may fracture. Besides the headaches, you may also suffer from neck and shoulder issues. The main cause of the Bruxism is believed to be multifactorial, but the main provoking factor number 1 is stress.
So Anni, when to seek medical assistance?
If the symptoms affect your everyday life and you need to take painkillers frequently or your sleeping is poor because of the night grinding. If your spouse comments about the negative nightly noises coming from your mouth, then the best option is to seek help.
It's always cheaper to get the braces than get yourself divorced.
Grinding of the teeth does not cause pain for everyone, and if painless, the untreated Bruxism can cause severe damage to your teeth. Thus, routine checkup at your dentist is important to interfere and treat grinding of the teeth.
Typically, Bruxism is connected also with the issues in the upper neck area, and if the proprioceptics of the upper neck have changed from ischemic issue, then you might end up having dizziness. But if you are needing for the easy exercise for the upper neck area, here is a great recommendation about the video concerning about that kind of topic. Well, there you go. If you want to seek self-management for the Bruxism, next it will going to be the suggested video once it gets done. Before that, end suggestion is the tension neck headache video. Also, I made another video where I go through the differences in muscle activity and about hearing with person with Bruxism. Hit the thumbs up if you find this video helpful. Dare to be different.